and snacks from schools. But what does one feed their child or children as healthy alternatives, and how do you go about making changes to their diets, especially if it's an energetic child? I'm joined by Paediatrician Dr. Gillian Wheeler. Good morning.
Good morning.
How are you, Dr. Wheeler?
Good morning. I'm quite fine this morning.
And how is Tobago?
Tobago is sunny this morning.
Yeah, and what about the traffic? It's the first day back out to school.
Well, I haven't had to deal with the traffic as yet.
Well, that's a blessing. So we're talking about healthy alternatives for children, for school children, especially with this change being implemented where sugary drinks have been banned, especially, well, drinks and snacks have been banned from schools. Let's talk about some healthy alternatives, and how challenging would that be to introduce healthy alternatives to children who have grown so accustomed to having all these sugary foods?
Okay, well, the ban is on sugary drinks being sold in schools. So the school cafeterias, the Ministry of Education has issued a release that no soft drinks, no sugary juices, no energy drinks, sports drinks, any drinks with added sugars or artificial sweeteners would not be sold in schools. This means that parents can still send them with the child to school, but they would not be sold in schools. And the reason for this, and well, the alternatives are water, 100% fruit juices, and low-fat milk. So even the milky drinks, teas or coffee with added sugars would not be sold in schools. And the alternatives would be water, 100% fruit juices, and milk. So those are the options available for children in school. And this actually it has been done in at least 2 secondary schools in Tobago where the cafeterias do not sell soft drinks. And they did sell some other types of drinks, malt, some milk drinks, but now what the children did was that they bought the water. They did buy flavored water, but that actually would not be sold in the cafeterias as well. So that is not an alternative. So the message really is to drink more water.
Okay. So as far as you're aware, that ban has been placed only on drinks and not necessarily snacks?
At this point, it's on drinks.
All right. Now, would you say this has been a good move? And also, what sort of impact do you see it having?
Well, it's an excellent move. And why did the ministry make this move? It has to do with the significant rise in childhood, the incidence of childhood, the overweight and the obesity in children. And the ministry has the data from some surveys that were done. And in 1999, about 11%, so 1 in 10 children was overweight. And in 2009, that was about 23%, which is almost 1 in 4 children. So in the average classroom, you're talking about probably 4 children being overweight. And obese, back in 1999, 1 in 50 children was obese. And in 2009, that was 1 in 8, which means in the average classroom, you had at least 3 to 4 children who were now obese. And, there's significant health risks for this. When you're talking about children being overweight and obese, you're talking about diabetes. And have been practicing in Tobago for almost 20 years. And I worked at the hospital for most of that time. And 20 years ago, 10 years ago, we had about 1 child being diagnosed with diabetes. And that was the type where their pancreas was damaged. The juvenile diabetes where they required insulin. And over the last few years, we have maybe 2 or 3 children being diagnosed with diabetes. And some of those children is the type 2 diabetes. the adult diabetes, which you develop as a result of being overweight or obese. So you have increased incidence of diabetes, high blood pressure, high cholesterol. This can lead to something called a metabolic syndrome, where your ovaries are affected and your periods become irregular, and it affects your fertility. You have children when they're overweight or obese, it affects how they feel about themselves. They become less active. They may be subject to bullying, and taunting and teasing. It affects their self-esteem. They may become depressed. So there are significant health risks associated with, being overweight or obese. And those figures that I told you go back to 2009. Where in 2017, I understand that a survey was done recently by the Ministry of Health in collaboration with the Ministry of Health, and the figures for that have not yet been released. But, it's significant, and the health risks associated with, being overweight and obese. And a lot of this is driven by the ingestion of, or drinking the sugary drinks and soft drinks. There are other things in the diet as well, but that is one particular factor, the fluids with the added sugars that help to drive that.
Now, so this drive is also essentially geared at increasing the water intake for the students. Now, parents would also need to get on board with this initiative, clearly, because in order to make it effective, they would need to also ensure that at home that the kids are drinking their water and they're not, going back to the soft drinks.
Right.
So what measures would you suggest be put in place? Would you say educational drives for parents?
Well, certainly, because this, banning the sale of the drinks in school, the children can still bring the drinks into school. So, of course, a public education campaign as to why this measure has been taken would certainly be beneficial. But remember that in school, children, even from preschool, primary school, their primary school life, their secondary school life, they are actually taught about the benefits of fruits and vegetables and, what a healthy diet is. And, of course, you want to include parents in this as well, and grandparents and the society as on a whole. Because I mentioned obesity in children, but in Trinidad and Tobago, more than 50% of adults are overweight or obese.
Now, for children who may give some trouble, a lot of parents, they have problems allowing their children or causing their children or having them move away from the sweet soft drinks. What advice do you have for parents to help them to get their children on board and to understand how important it is for them to increase their water intake and reduce their soft drink intake?
Well, I can tell you what happened in real life in the two secondary schools in Tobago where they stopped selling soft drinks. They did continue selling juices. The children, they bought the water and they bought what was available. Now, some children did, after school, flock to those places outside. Some of them, and buy soft drinks then, but during the day, they drank what was available, which was water. And you do see, as a credit to our young children and teenagers, you do see more and more of them drinking water.
Well, that's a great sign. Well, it's a pleasure chatting with you, Dr. Gillian Wheeler. Of course, they are commenting on the recent move by government or the Ministry of Education to ban sugary drinks at school. So we take a short break and we return with more. Stay tuned.